Welcome back to MD VOD, where we're here with orthopedic spine surgeon Dr. Robert Watkins, and we're talking about back pain and arthritis. Welcome, Dr. Watkins.
Thank you.
Thanks for being here.
I appreciate it.
So what is arthritis?
Arthritis, by definition, means inflammation of the joints. And so anytime you get pain, swelling, stiffness in any joint in your body, it can be in your hands, your fingers, your knees, your back, your neck, any inflammation, pain, stiffness in any joint in your body is arthritis. So it affects basically everybody at some point in their lives.
And what are the different types? Like, what are the common types of arthritis that you see?
Osteoarthritis is number one, and that's basically just degeneration of the joints. As time goes on, as we all live long enough, our joints will have wear and tear and become to get inflamed, start to have pain, and develop stiffness. So that's osteoarthritis. That's what everybody gets. There's other inflammatory conditions that affect your entire body, which then can affect the joints, like rheumatoid arthritis, psoriatic arthritis, which are more systemic inflammatory conditions that only certain people get. Whereas osteoarthritis is what basically everybody gets.
What are some of the risk factors for developing arthritis?
The main risk factor is just being alive and living a healthy, normal life and being active. Like I said, it affects everybody. But if you live a sedentary lifestyle, that can actually put you at more risk for developing arthritis. Your joints need to move in order to circulate the nutrients in the blood. Joints don't have very good blood supply. And so they need to circulate. You need to move and walk and circulate your joints in order for the nutrients to get to the cartilage and for the joint to stay healthy. So basically doing cardiovascular exercise 3 to 5 times a week for 15 to 20 minutes. Anything you can do to move and to loosen up your joints. Unfortunately, a lot of people who have arthritis are in pain, so it's difficult for them to move and to do different activities. But if they can get in a pool or even on land, lay on their back and move their joints, do anything they can do to circulate their blood and circulate the joints will help them.
And it's actually good for our bones as well as moving.
Yeah, that's exactly right. In fact, the worst thing you can do to a joint, the quickest way you can develop arthritis is if you put somebody's joint in a cast where it can't move.
Wow.
And if the cast stays on for a year, the person will develop arthritis in that joint. So it comes back to the principle of use it or lose it.
The back, is the back an important thing to think about when we get arthritis?
Yeah, I think that is important. A lot of people don't associate their back as being a joint. And they think, and I'll tell them, well, you have arthritis, and that's what's causing the pain in the back. And people look at me like, no, it's not arthritis, it's my back. And no, you get arthritis in the back. And it's important. Looking at our model, everybody needs to realize this is a life-size model. This is actually the correct size on us. And in your lumbar spine, you have 5 discs, and for each disc in the front, you have 2 facet joints in the back where the motion occurs in the back. So for each one of these levels, you have 3 joints. And between here and here, basically, between our belly button and our pelvis, we have 15 joints that can all develop arthritis or some type of pathology and be a source of pain. That's why I think some estimates have shown 50% of Americans will have some significant flare-up of back pain, which they'll have to miss work for at some time in their lives. 50% of people, that's because there's so many joints that can develop pathology and be a source of pain. So that is arthritis that affects the back and the neck and the mid-thoracic spine. And it's the same disease process of wear and tear that occurs in your knees and your hips. It just happens in your spine.
Once you diagnose your patient with arthritis, Dr. Watkins, what are some of the common medications that you start with your patients?
Now, we generally start, our 4 basic treatments for osteoarthritis are oral medications, physical therapy, injections like cortisone injections, and then surgery. And surgery is obviously the last resort. Nobody wants to have surgery, and it's the last resort for us as doctors as well. Some of our most grateful patients are the ones that we treat non-operatively. I'd say 80% of the people we see in our office, we treat non-operatively. And so surgery is reserved for those who are not getting better without it. But we start with oral medications, ibuprofen, which is basically Advil, over the counter. There's a great medication that often gets overlooked because everybody moves on to the prescription medications and everything else. I own a big bottle of ibuprofen I buy at a warehouse store. I keep it at home, and that tends to treat most problems. If you have problems with your stomach, or other, like gastritis or history of ulcer, stuff like that, some of these anti-inflammatories can cause problems. There's always a risk with any treatment, so you need to check with your doctor to make sure that everything, that you're safe to take anti-inflammatories. But ibuprofen is one that gets overlooked. Aleve and naproxen are also common ones, but ibuprofen happens to be my favorite.
My favorite too. Great advice. And let's say someone comes to you, they've got back pain, you diagnose arthritis, and you treat them with some Advil, they get a little bit better, and you send them to a physical therapist. What do the physical therapists do to strengthen your back? What are they doing?
Our main goal, so the main point of the anti-inflammatories is to decrease the inflammation and the pain, to allow the patient to do the physical therapy. And because the anti-inflammatories and even the cortisone shots are not permanent treatments. The permanent treatment is going to be to get your core muscles strong, your trunk muscles and your postural muscles strong, to take some of the pressure off the arthritic discs and joints in your back and put it on the muscles. And so we have a very comprehensive rehabilitation program that we take care of a lot of professional athletes, and a big part of taking care of athletes is the rehabilitation and getting the muscles firing and working in a proper manner to protect the spine so that an athlete can go back and play their sport. Well, it's the same way we treat all our patients. Everybody has a job they have to get back to, or some recreational sport or some basic exercise. And getting your muscles strong to maintaining good postural alignment of your spine basically takes the pressure off the painful joints and puts it on the muscles. And that's the best non-operative care for everybody of any age.
That's, again, great advice. It makes me want to sit up straight. But let's say you know, we've treated your patient, they've been taking Advil, they go to the physical therapist, but they continue to have, let's say, sciatic-like pain, and their back pain's not going away. When would you refer someone, or when would you operate on someone?
Like I said, surgery is the last resort, but at the same time, there's a lot of people suffering in pain for a long time who have tried physical therapy. They've gone to 50 physical therapy visits for 2 to 3 years. They've done anti-inflammatories. They're taking some pain medication. They've tried epidural injections, and there are a lot of people suffering in pain. And that's when surgery really can help people. The key to my job and doing spine surgery is knowing exactly what's causing the pain. So we spend a lot of time with the history and physical and diagnostic studies to know exactly what's causing the pain, because if we know what's causing the pain, we can generally help people. And so that's the key to spine surgery. The surgeries themselves, the technical part of the surgery, is certainly something we practice and good at. But the real key is, do we know what's causing the pain? And that generally determines whether we can help somebody or not.
You know, you do some incredible work. You know, you're an orthopedic spine surgeon, and it's incredible technology. What are some of the newer ways that you take care of people today with back pain?
Yeah, it's one of the funnest parts of my jobs and most satisfying is that there is a lot of new technologies in spine surgery. I spent a year training in England and traveled around Europe and have been to Asia. And one of the great things about being in America is the technology is the best in this country for treating spine surgery. And that one of the examples is we use computer guidance. We literally get a three-dimensional picture of the spine in the operating room, and we have a computer that guides us to put screws and different instrumentation into the spine. And like when I did my training in England, we basically just did it by feel. We used our hand and felt our way down the bone, which works okay, but now we use a computer, and it's all three-dimensionally guided, and it makes the surgery much safer. And so we can perform surgeries much safer and faster, and also less invasive. One of the other great things in spine surgery is the minimally invasive techniques. We use tubes. Instead of making a big incision and opening everything up, we'll work through a tube and a small hole, do all our work through the tube, pull the tube out, and the hole in the muscle closes back down. So it's much less invasive. People get faster recovery. And overall, we preserve better muscle function so that they can do the physical therapy and the rehabilitation sooner and more effectively down the road.
Wow. How quickly, typically, do people recover from this kind of back surgery?
Generally, the most common surgery we do on professional athletes is a microscopic discectomy for a lumbar herniated disc, which is probably the number one treatment, the number one condition I see in all patients, is a herniated disc. Now, most of those we treat non-operatively, and especially in professional athletes, because, like I said, nobody wants to have surgery, especially a professional athlete. And so we treat everybody non-operatively first. But if it comes to surgery, generally recovery is 3 to 6 months. Well, they will be back in their sport playing at a professional level. We've had people go back as early as 6 weeks. People have gone back and played in the Super Bowl and in the AFC Championship and other very important games can go back sooner than that. But in general, 3 to 6 months is a pretty good guideline after that type of surgery. Same thing with cervical surgery. We do some cervical fusions, also go from the back and do foraminotomies, just make more room for the nerves in the back. And recovery from a cervical foraminotomy is about 6 weeks to 3 months. A fusion in a neck can be 6 months up to a year.
Does insurance typically cover the costs?
It generally does. It obviously depends on who the payer is. Is it Medicare or insurance or HMO or workers' compensation? But in general, anti-inflammatories, a doctor visit, physical therapy, potentially a spinal injection are covered by most insurances. Insurance companies have become more unpredictable, and so you can't always tell whether what they're going to cover or not. And it's important for the patient to ask their insurance company beforehand, is this covered or not? Some of the newer technologies like artificial disc replacement and other products, some insurance companies don't cover. And it's important for patients to know that beforehand.
Great advice. So we've heard a lot today from literally one of the world's outstanding orthopedic spine surgeons. I want to thank you, Dr. Robert Watkins. That was outstanding information.